it's months, right? It takes months and months and months. And but every day you just notice it's a bit better, a little bit better.
Yeah, you gotta be patient. You gotta be patient. I always tell people that you gotta be patient. Give it time. It will get better. I get frantic calls at like usually the 3-month mark where people are like, where's the hair? Where's the hair? Hey guys, Dr. Gary here. So I heard about this Preach Gaming hair transplant, and I'm going to do a reaction to it. I've honestly never seen this before. A lot of times I'll kind of preview something before doing one of these videos, but we're going to jump right in here. So this is called Hair Transplant Reality, 6 months in and round 2. So here we go.
6 months ago, I had a hair transplant. The comment section has been filled with the progress of it. And yesterday, finally, now that COVID lockdowns are starting to shift, I was able to visit my doctor and see exactly how it's going, up close and personal. And of course, I'm about to have it all shaved off because this is not the end of the story. Let's do the update.
Very intergalactic.
As you can see, I have the
intro.
green screen off so you can see it fully. And I want to be thankful to how many of you are like, that looks awesome. That came out super well. Yes, I'm very happy with how it came out after the first one.
Just to give you guys some initial thoughts, I don't know where he started. However, just looking at the hairline, the way I'm seeing it here, the hairline edge itself looks too regular, in my opinion, meaning that it looks like a line was drawn all the way across. And when you look at a natural hairline, there's a regularity built into it. There's micro and macro regularity that's built into any natural hairline. So when I'm looking here at his hairline, it looks too regular, like almost too perfect. And the eye can perceive that sometimes as less natural. And then the height of the hairline, again, it depends on where he started, but I do like that they didn't go straight across and that there's some degree of recession left that is more of a natural type of mature sort of hairline look. So it's good that they preserved that, at least, where the frontal peak is more forward or anterior than the frontotemporal angles. That's kind of a key thing. So let's keep watching.
We are having 2 done because this is kind of a lie. I could look face on at a camera and it looks totally fine, but the reality is there's a big old bit at the back that still needs...
Yeah, he's got a big exposed crown, but that's okay. That's okay. A lot of times when I'm counseling people on hair transplants and how to properly decide how many grafts to choose and, what are we going to cover in the first session, this comes up, right? If you have a pretty exposed frontal and mid-scalp and crown, it's very difficult in one session to just cover all of that with hair. And I do believe in sort of staggering treatments and doing the front and mid scalp first, get that to a happy place, and then later on working on the crown. There are some people who choose to try to get as many grafts into all 3 areas at once, but I generally will advise against that. So it looks like here maybe they didn't do too much into the crown, and it's not a bad call. Now maybe they did put a lot of grafts into the crown, they just haven't grown in. I'm not sure, but let's see if he elaborates on that.
Back that still needs doing, as you can see there. So we still have this going on. Now, I had a lot of Zoom calls with my doctor over the 6 months who was checking up on it with a phone camera. Not ideal, but yesterday I got to go into Manchester city centre, actually stand with him and have the assessment done of what we want to do, and more importantly, what don't we like? Because it's not perfect by any means, and this was always the plan, was to do it in 2 stages.
And again, that goes back to what I was just saying, that it's okay to plan things out in stages when it comes to hair transplant. It's actually even better. And sometimes those stages can be a year apart, sometimes they can be many years apart. But a lot of patients come to me and they're like, I want it one and done, I just want the surgery. And they don't want to be on any medications, they don't want anything else but one surgery. And honestly, a lot of times that's not too realistic, especially with more advanced hair loss at younger ages.
So I had a choice, if you remember from way back when, that I could have had my first bit done, and then almost like a couple of weeks later I could have had the back done and done it all in one.
And sometimes you can do that. You don't need to necessarily wait a year for all the hair to grow out to do a second transplant, but the caveat there is that the recipient area has to be different. So if you did the front and the mid scalp in one session, you have to then, if you're going to do another treatment, say a month later, it can't be directly into that same area because you'll be injuring the grafts that you've placed and you don't know know exactly where they're going to grow out or how well they'll grow. So you'd have to wait then at least 10 months, 12 months to go back into the same site. But if you're going into a different site like the crown, that you can just wait a few weeks and get right back into it and then do that second treatment. So it is possible to do transplants at different locations just, a few weeks to a month apart.
What I wanted was to have the front done, then wait, and the guy said like 6 months until we really start to see how it's taking shape. Then we can sort out what we want to do with the rest of it.
And the reason to wait and to not just do like 3,000, 3,500 grafts right off the bat in one big procedure is because you don't know exactly how the front and the mid scalp will grow. And that's really the most critical area for just naturalness and for being able to interact with others and for them to see you as having hair, right? That's what people want. Most interactions are frontward facing. So that's the reason to wait. And because let's say you dump 3,000 hairs into kind of everywhere and some of the front didn't grow out as well, then you have to go back and you have less of a supply to work with. So it's better to use up a good amount of your supply on the front and mid scalp. Be happy with that before putting a lot of hairs into the crown.
So we can get it exactly as we want it. Now, I am happy with what we've got, but definitely some missed bits. Overall, I got 90+% of my hair transplant that took place worked.
And that's fairly standard, 90-95% regrowth for scalp to scalp transfer using modern day techniques.
That is in the very upper high echelon for our World of Warcraft fans out there. That is a 90th percentile. We're happy with that. They expect anything above 80 to be considered good. 90 is fantastic. So what it does mean is the hair on the back of my head and the sides, which is what is now on top of my head, is good. Really healthy, really good stuff. And therefore, we're happy with this. But it's not perfect by any means. It's still relatively thin. You see, if I move it around, there's still a thinness there.
And the thinness has partly something to do with the thickness of the hairs themselves. Patients with thicker hairs will have more of an appearance of higher density compared to someone with thinner hair. And also it has to do with how many grafts were placed. But remember, there is a limit to how many grafts you can pack into a certain place. If you overdo it, which in some parts of the world they like to bombard one small area with lots and lots of grafts beyond the point of safety, then you can actually get necrosis, where a part of the scalp actually dies and then all the hair dies off because of the lack of blood supply. So when we make all these little recipient sites, if you make them too close, then there isn't enough blood supply to feed your grafts and also feed the skin in that area. So if you have an area this big and you just poke 1,000 little holes into it, there's not enough blood supply then feeding this area. So you have to kind of poke fewer holes to still have some healthy skin that will allow this area to heal well, whether with grafts or without grafts. And so that then leads to sometimes a thinner sort of look because it was probably done with safety in mind.
Yeah, you can't see it when talking to me, but if I move it around and like manipulate it to try and show you, you can see there is still thinness there. You can see there, right? There is still a thinness to it. So we got to sit down, and I'll talk about how it feels and stuff later on, but we got to sit down and decide, what do we want to do next? What is the next maneuver? Well, I felt personally what I want to have happen next, and this is going to be happening on July 6th, which means I'm going to have to shave all of it off. So I'm definitely going to have to deal with a lot of comments like, what happened to your hair? Because they're going to shave it all off.
So my practice for FUE, we shave the back and sometimes the sides, but we don't shave the recipient area. I like to do my transplants and I'll make all of my sites into areas of existing hair. It's easier to see gaps and that sort of thing, in my opinion, than when the hair is shaved down super, super short. That's just my preference. And also then you can use your existing hair at the recipient area to cover over the grafts while you're healing, which is another big benefit, as opposed to just having everything shaved off.
So what I want is everything that happened here, I'm more than happy with that happening at the back. This is thick enough for me. It looks fine. Like, nobody cares about it at all. They're all like, yeah, it looks great. So I'm going to have this done at the back, and I'm going to have this bit thickened out a little bit. But only a little bit, because this is actually fine. I'm more than happy with how this came out. But we're going to do that. We're going to do exactly what we did on the top here at the front. And there's some images there of what it looked like previously. and have that done on the back.
Yeah, I mean, he really started off with almost nothing, so it seems like they did a nice job for him. Like I said, I think the overall placement is appropriate of the hairline, but I would like to see it a little bit more irregular. I think that would give him a more natural appearance. As far as doing the same thing like he said here in the back tends to consume a lot more hair. That's because of the rounded nature of it. It's because things tend to grow more radially. So in the front and in the midsection, you've got the advantage of an overlapping effect. So that builds up the density because you got hair here, hair here, here, and everything is going forward. As you get to the crown, you've got this radial type of distribution. You don't get as much benefit from the overlap, and that's why you need a lot more hair to create as much of an impact compared to here. So I think what he's going to find is that it's not going to be as dense looking when his crown is done.
There was a slight issue that Emma noticed where this bit didn't take right in this corner, but like you guys remember, I didn't even have this hairline when I was younger. Like my hair has always been a sort of Dracula shape, but it's not now. So they're going to try and even it out a little bit, like with one or two things. My next procedure is going to be bigger than the first one, only slightly. It's going to be 3,500 hairs.
Okay, so you're saying 3,500 is what they're planning for the second treatment. I wonder what the first one was. Let's see if they say.
That are going to be moved off the back and the sides, and they're going to use more of the side in order to make sure the back is fine. So if I can show you the back.
So based on what he has here, my guess is he had something close to maybe 1,800, 2,000 grafts, though he hasn't said it yet. Maybe in a prior video he did. But then now they're planning 3,500. My guess is they're going to use maybe 2,000 in the crown and 1,500 out in the front for additional coverage.
This is where they took the hair from. Actually looks totally fine. No issues there whatsoever. It doesn't look thin or anything.
And that's the other advantage of doing your treatments in stages, because you can then see how the donor area grows in and make sure that it hasn't been completely depleted, because you want that to look relatively natural as well. In places where they do these mega sessions of like 6,000 grafts all at once, they basically destroy the donor area and there's like nothing left, and then it doesn't look very good.
How does it feel? It feels a little different than what your ordinary hair would be on top of your head, for those of you who've been asking that. It's only very slightly, but you can tell. Like if you feel the back and sides of your hair, it feels a little different to what's on top. So obviously I have back and sides hair on top now, so that feels a little different. It feels a little drier than ordinary, but you can do whatever you want with it. I haven't touched this at all, like at all. I've not cut it a single time. And to be really importantly, this is halfway through what this will eventually be.
In terms of haircuts, some people ask me about haircuts at the recipient area. I usually tell them to wait about 3 weeks, and then it's safe enough to get a haircut, assuming you had hairs to begin. Because remember, the transplanted hairs, the shafts will fall out at about 3 weeks. So if you had nothing to begin with, he didn't have much, there's like no hair to cut, right, in his situation. But in other people's where you still have a lot of just pre-existing hair, you can get a haircut to involve the recipient area after about 3 weeks post-op. As far as the back is concerned, because we shave part of the back in most situations, so if you wanted to get a fade for the back, you can wait about 4 to 5 days. It really doesn't take long to get a fade and have that look more presentable.
Something the doctor was very, very insistent on letting me know when I was saying, hey, you can still see like thinness there, so can we just thicken that out? That's all I was asking. And he was like, you need to trust here. You're only halfway through. It takes like a year, if not longer, to see the full thing happen.
Yeah, so he's only at 6 months post-op now. I tell patients that it takes 4 to 6 months to start to see the hair sprouting and growing in, and then it takes about a year for the full growth. So he really is only halfway there. So I agree. I think that it will appear more full and filled in over time.
Like a year, if not longer, to see the full thing happen. You need to bear in mind and trust the process a little bit. We're happy to thicken some of it out, but honestly, it's going to get thicker and thicker over the next like 7 to 8 months, and you don't want to end up with it being weird, right? So he's like, where you are right now is fantastic.
And because of that, when he's planning this round 2 procedure, he said July. So again, I would have to go back and see when he had this initial one, based on his post and all that. But basically, like, you don't want to do another transplant into this recipient area if it's been less than a year, or approximately a year. Because, if you do that too soon, then you're not giving all the hairs that you transplanted a chance to really grow in. And then it's hard to judge exactly how many more hairs you need for the secondary procedure. So the crown, fine. If they didn't do any in the crown, they can plan that out. But I would wait the full year before going back into the recipient area.
All the horrors we went through with not sleeping for those first 4 days, as I told you guys, the first 4 days are the hardest part of this whole process. That bit was the important bit, where you're spritzing every 20 minutes. You can only sleep for like a couple of hours, then you have to wake up and keep it moist.
I disagree with that. My patients aren't waking up in the middle of the night. We do give them a spray for the recipient area, but they start the next morning and they continue that up to about 48 hours, at which point you can take a basin with water, dab some shampoo, and put the water over your head. A shower is okay at day 6, but my patients are not waking up to put the spray on. It really isn't that critical to get the hairs to grow. I don't think patients need to generally do that. So in my practice, the first 4 days are not miserable. The first evening is kind of a little bit painful, uncomfortable, but after that, patients do extremely well.
Still to this day, people ask me like, does it hurt and things like that? No, didn't hurt. It was just really boring. It takes all day.
That's the experience of my practice. It doesn't really hurt. I mean, you feel the shots going in to numb it up, but we give people medications to help them relax, and it is a long day. Usually it's really a non-issue, and it's kind of fun. We get to chat, especially in the second half of the day when we're placing all the hairs, kind of keep it fun. So it's really not a bad day.
Overall, I'm really happy with it. As you can see, like from a conversational point of view especially, it's totally over the moon with it. Couldn't be happier with it. Did not come out looking weird. Didn't come out looking like a chia pet. Didn't come out looking like some sort of like, it didn't look obvious. What you could do, you can absolutely, and you're never going to get away from this, if you like zoom in really close. So if when my wife checks it and she comes really, really close, she's like, okay, I can kind of see something, but you do have to be doing that level of inspection.
I'm definitely glad he's happy. You know, a lot of people do elective cosmetic procedures and then, you know, they're disappointed. They feel like maybe it wasn't a good use of their time and money. But I think if it sounds like whatever clinic he was at for the hair did a pretty nice job in setting the right expectations, and, you know, they did some good work, and that's great because, you know, if you kind of put it all out there, that's my sort of MO. If I put it all out there in the consultation and through all my videos and you know exactly what to expect, then it's a lot easier to digest the whole process than when you really don't know what's going to happen and you thought you were going to have as full of a head of hair as you did when you were 18, and then you come out looking thinner. And so some people could get disappointed if your expectations weren't set appropriately beforehand.
So that's where we're at right now. Obviously, it's a bit of a scam when you see it in videos because I can stand like this, everything looks fine, but you can see there's that there. But this is exactly as intended. What I'm really hoping to do is get the procedure done. July 6th is when I'll be having it done. And then 6 months after that, it should be pretty much where I am now should be everywhere. And that should be the golden standard of it. Are there any drawbacks that I've had so far? I think that's important to talk about. Only just the waiting for it to kind of grow. And the unexpected nature of the after process. Because although they kind of describe it to you, until you experience it, it's awkward to really say what it's like. It's months, right? It takes months and months and months. But every day you just notice it's a bit better. A little bit better.
Yeah, you gotta be patient. You gotta be patient. I always tell people that. You gotta be patient. Give it time. It will get better. I get frantic calls at like usually the 3-month mark where people are like, where's the hair? Where's the hair? And I tell them, look, you just have to wait and you'll see it. You know, it can be a long time and some people get very impatient.
It's a long process, right? It's got to be after July 6th, it'll be another 6 or 7 months before it's kind of where I want it to be. And I'm probably not being asked about it at all. As it is right now, all I could say is it's definitely something that has changed people's opinions of it, which has been great to see. There was a lot of people even in my real life were like, this is going to look a little bit odd, right? Because they'd seen the horror stories, but since then it's been like, no, that was incredible. That looks really, really good. So very, very happy. Very happy. Looking forward to have the whole thing done. And just being done with it, really, because it's, like I say, it's really boring and it just takes ages. And I'm going to have to shave my head again. So that's going to be a whole thing we have to deal with. But that's where we're at after 7 months. So yeah, you can see that. I want to be completely clear with you. You can see it's a little thinner, right? It's like a weird tuft here, right there. You can see exactly where they started was like there to make all this, to make all that happen. So perfectly bald there. So let's remember this screenshot, right? Let's remember this. and then see what comes out of this in 7 months' time to see exactly what it looks like. And then we'll probably get the final picture of this. But for everybody who's been asking, I hope that answers your questions. If you do have more questions that I maybe haven't answered here, hit me down below.
It'll be fun to see his next follow-up on this, and then we'll do a comparison and we'll give you more thoughts. But if I had to guess, I think he's going to feel like the crown isn't as filled in as he was hoping it would be. And again, that's just the nature of the crown. Even just an orange sized area of the crown can easily consume 2,000 grafts and still give you less density, or the appearance of density or fill-in, compared to the frontal and mid area. So just a difficult area to treat. So good luck to him, and this has been really fun. See you guys. Make sure to subscribe. Thanks.